Well, good afternoon, everyone, and welcome to today's webinar, which is Data-Driven Insights for Safety. My name is Holly Foxworth. I'm a registered nurse and the Director of Marketing Communications here, and I'm thrilled that all of you have joined us today to learn about how it is that you can use data to make your workplaces safer. So sometimes we see that companies will wait to fix things until something actually happens, but we strongly believe that you can use that data to be able to help solve problems before they ever start, and so that's what our goal is today, is to give you a peek at some of the key data that we collect across all of the industries to help identify some of those trends, and then also for those that apply to you, provide some practical recommendations that you can implement there in your workplaces as well. So joining us today on our expert panel is Chief Medical Officer Dr. Scott Cherry. We also have Chief Marketing Officer Dara Wheeler. So you will meet them both shortly, but before they introduce themselves, let's take a quick look around your screen, get you familiar with what you're looking at, look at some key areas, especially if you like GIFs, and then we'll talk through some of the remaining things that are still to come in 2024 that you don't want to miss. So there, on the right-hand side of your screen, you should see that there's going to be a green box there with the RSVP button below that. And so that is for our Bounce Back Stronger Resilience training webinar that we're going to have this next month. That will be November the 14th. And so that will be at 1:00 p.m. Central. And you're not only going to get one physician there, you're actually going to get two. So we're going to have Dr. Les Curtade that's going to be back with Dr. Cherry talking through how resilience isn't just a buzzword. So definitely don't want to miss that one. And then just confirm this week, we're going to have a December series that's going to be coming out. It's called Under Pressure, the hidden dangers of the holidays. And so we're going to go through not only the physical pieces, elements of safety that could be dangerous, but also we're going to talk through mental health concerns as well. So we'll talk through seasonal affectiveness disorder, seasonal depression, things that go along with that. And for that one, we're actually going to have our CEO, Mark Robinson. He speaks very passionate about the subject, and I know that you'll love to hear from him. So lots of fun things to look forward to. Again, to be able to register, especially for this next one, all you need to do is click that blue RSVP button, and that will get your seat reserved. You don't have to answer any additional questions or fill out any forms there. So as always, these events are recorded, and we will make that on-demand version available to you, usually within 24 hours is when those come out. But you can also find a copy of today's slide deck that's located right there at the bottom of your screen. I believe it should be on the right-hand side there. And then finally, we love hearing from you. We really like for these to be interactive. And so the best way that you can do that is by utilizing that Q&A chat box that's at the very bottom on the left-hand side. And so you can use that we'll be asking questions, so you can respond there. You can also ask us questions individually. And then especially, I love the personal stories, you telling us what's going on in your workplaces, some of the tips and tricks that you guys have. I love when those come in, and actually that is the first place that I go whenever it comes to sending out gifts. So if you like gifts, that's where you need to be as well. Definitely don't be shy there. So let's go ahead and meet our presenters. Dr. Cherry, I'll let you introduce yourself first, and then we'll move on to Dara.
Thank you, Holly, and good afternoon, everyone. Thanks for tuning in. My name is Scott Cherry. I'm Axiom Medical's Chief Medical Officer. My professional background is I'm board certified in preventive medicine, public health, and occupational environmental medicine. So medical credentials you would see commonly like as a CDC medical officer, but I've been supporting the military, corporate, and industrial operations for the past 15 years, and it's a pleasure to be with you.
Awesome. Dara?
Thank you, Holly. Thank you, everybody, for joining us today. My name is Dara Wheeler, and I'm Axiom's Chief Marketing Officer. This is my 18th year serving our clients at Axiom, as well as our employees. And this is a topic I get really excited about. I like getting into data and what we can do with it. So we're really happy to have all of you.
Awesome. Well, I appreciate both of you being here. I see that there's some signs that there was somebody that had mentioned they're not seeing the RSVP button. So we'll look on our end and see if there was something that's going on with that. But definitely, if not, then we'll make for sure that we get an email out to you so we can get you registered. The first thing up is a poll. This is the first poll of the day. And so we had talked about data, and we're going to talk about some of those key things. So this is one of the first subjects that we're going to talk about. So your first poll of the day is, which days of the week does your company typically experience the most injuries? So which day of the week do you feel like that you have the most injuries that are occurring there in your workplace? And your options obviously are Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, or Saturday. So while you're answering that, then we'll go ahead and talk through some of the things that we're going to get through today specifically. So we're going to go over injury occurrences, which that includes not only when those injuries are happening, but also some changes that you may want to make to prevent some of those. We're going to talk about injury types. So what type of injuries are most frequently occurring and how it is that you can prevent some of those. Injury reporting, so how quickly are those injuries getting reported, and then how does that impact your outcomes, and then what might you want to do to change that for improvement. And then we'll get into some of the psychological and fatigue components as well, and how they impact your injuries as well. So Dara, I'm going to come to you first and just kind of ask you, what is the real value of data? Sometimes we talk about data and people's eyes glaze over, but is there value that comes along with that?
Yeah, absolutely. You teed it up well, Holly. So we are going to dig through the data, and we don't want it to be, this is not meant to be kind of us just throwing numbers at you. So like Holly said, make sure you're asking questions or jumping in or communicating with us. We like to interact throughout. If something is jumping out at you or you want to participate, please do, because Holly does follow up and send people some nice little things if they follow up. But data for us is more about, okay, so what then? What does that mean? What do we do with it? How do we make changes in our organizations based on the information and the data we're collecting? So this, we see that a lot of executives believe that decisions are driven by data, but very few are using it or using it well. So thinking about the various topics we're going to cover injury data, we're going to cover behavioral mental health data and fatigue data. And these all are definitely safety heavy on the safety topics, but with safety and health topics. But if you think about what this means, this data is real information and data we gather in the thousands of cases we handle every year. I think Holly's pulled everything from this year to date, but all of our clients, we do a lot of individual data conversation, have a lot of individual data conversations. So this data that you'll see, although it's aggregated, we do have the ability to drill down within organizations and have those conversations and have the what does this mean for us conversation with our clients, and what that looks like for practical recommendations on making changes year over year, which we do see at this time of year especially. How do we make changes going in to 2025 to be safer and healthier in the workplace?
Yeah, one thing I'd like to add to this, Dara, is I had to make this paradigm shift myself, going from individual medicine to population health. And it can be very powerful, but it can also make people glaze over if they don't really have the why to bear any how, right? And so I think a lot of times in our own professional work lives, whatever comes across our desk are usually outliers and they're anecdotes, right? And so obviously we have to deal with those outliers because they're usually extreme cases that are driving something that's taking a lot of energy from the manager, the director, or leadership, or even coworkers. But I think that's important, but also you can be misled by the outliers. So that's why it's important to have data to see what's the most common type of injury, when is it occurring, what's driving, what are those associated causal factors, what's the most common type of injury, and even looking at some extremes, like what's leading to maybe outcomes of that are less preferred. So, injuries that go beyond first aid, lost work time, things like that. And so that's a way to start thinking about it as, yes, I'm dealing with this one extreme case, but what's happening to the whole workforce on average, and being able to prioritize your energy based on what's happening based on data.
Absolutely. Well, just kind of to look at what you guys specifically said about some of your data and when some of your injuries are occurring, it looks like the majority of you had said that you're thinking that Friday is the date that you have the majority of your injuries occurring, with Monday coming in second there. So we'll kind of compare that to in the data that we have that goes across all industries, and you'll be able to see that. Derek, you want to talk us through this?
Yeah, so we've got a slightly different bit of feedback. So for all of the cases that we've had at Axiom called into us, our biggest, and it's a slight margin of larger case volume, is Wednesdays. Mm-hmm. And most of these are in the afternoon, so between 12 to 6 Central, with second place being the morning, third place being the evening. And then for our days of the week, it's definitely Wednesday, and then Thursday and Tuesday are the largest volume. And when Scott and I first started digging into data like this and looking at it, it was a little surprising. You wouldn't necessarily always guess midweek. And when we present this to the safety teams and the health teams that we work with, then they start thinking about the why behind it. And so that's one of the cool things about data like this. It's like, okay, well, this just is, it's numbers on a page, but why do Wednesdays crop up as the highest day? And when you talk to teams about the why behind it, often they start looking at shift schedule changes, people coming in and off shift, or are there certain things that they're doing culturally or from a safety culture standpoint that may be driving more injuries on certain days or reporting on certain days. So what this prompts when we present it is a lot of questions back into the safety organization to dig a little bit more to figure out, is there something here from a shift perspective, or is there something else going on that we need to address? Because it might be as simple as shift work or when safety meetings are occurring. So if we're holding safety meetings every Monday versus maybe we need to pay attention to having them every day, like a stand-up huddle, or every Wednesday as a point of focus. Dr. Cherry, anything that you jumped out at you here?
You know, just kind of reinforcing your points, to be honest, you know, I also was thinking more along the lines with what our audience had posed, that, you know, maybe Fridays are usually a big day because people are maybe having their mind on the weekend, or, you know, cumulative fatigue or complacency throughout the week that kind of, you know, manifest the last day. But really seeing it kind of in the middle of the week is also surprising to me as well.
Yeah. And, you know, I was thinking back to whenever I was comparing this to some of our 2023 data. And I think that we've always seen that Wednesday and Thursday were the most significant days. I think that last year it was actually Thursday that we looked at, that Thursday had a few more than what Wednesday did. But definitely every year that we're pulling these, Wednesday and Thursday are the key days that those are coming up. That's good points. Well, I'll ask you guys then, before we get into the next one, have Dr. Cherry talk about the injuries. What are some of the injuries? What are the main injuries that you're seeing in your workplaces? Are you seeing more of sprains and strains? Are you seeing cuts and lacerations? Would you say you're seeing more stings and bug bites? Maybe heat injuries? What type of things are you seeing there specifically at your individual organization? And we'll compare that with what we're seeing here. Again, you can use the Q&A chat box to put that in there. But Dr. Cherry, I'll let you talk through what we're looking at for the first 3 quarters of the Axiom data.
Yeah, I'm trying to figure out how to characterize my comments here, because it's very clear that musculoskeletal sprains and strains are historically always the largest proportion of injuries that I've seen since, you know, I've been doing this type of work. But what really hit me was the magnitude of difference. You know, we're seeing here 15 to 20 times the number of musculoskeletal injuries to all other injuries. And when I've looked back at workers' comp data, you see you see musculoskeletal injuries stand out as the majority, but maybe 2 to 3x. And so I think what's really important for this slide to focus on is really you need to know more about your musculoskeletal injuries. That's what's driving most of your injuries. And then there's a lot more to understand, whether is this acute or chronic? Is it unexpected or expected? So for instance, slips, trips, and falls are usually the most common cause of musculoskeletal injuries, but it's important to know if that's the case for your population, because it may be under, I consider slips, trips, and falls an unexpected occurrence, right? It's something happening as an accident or an incident that was unintended. Whereas if it's a strain from, repetitive lifting, that's under the expected course of your essential functions. And so because it's really the most common injury type, having a better understanding of the nuance that's driving this can really help you shape and how to prioritize your focus and resources. So for instance, if it's a lot of times there's ergonomic issues in the workplace, that we have a lot of clients that are very safety focused with doing hazardous work, but then it's the office setting that's causing a lot of injuries from either poor ergonomic setup or just slips, trips, and falls. Obviously, if it's happening within the course of the essential functions, just re-educating on proper lift techniques and training is absolutely crucial. Sometimes there can be assistive equipment that can really help the most arduous or most physically demanding work. But another important part is just warming up the workforce with stretching programs, perhaps implementing pre-shift warm-up and stretching routines that really help prevent injuries. And then potentially even job rotation and rest work cycles for, very physically demanding work. So again, getting a high level of the types of injuries that you're experiencing and then diving into cause of injury. And it can be during those outliers, right? Looking at what cases are driving, medical treatment beyond first aid, lost work time, et cetera. So.
Mm-hmm. And Dr. Cherry, we've had a lot of responses that came in. I'm seeing a lot of vehicle accidents that people are putting on here. Lots of strains, lots of sprains, the trips and falls, the slips, trip and falls, lots of good answers that were here. We did have one that was asking about industrial athlete programs there. Let's see, was asking about in-house industrial athlete programs. Anything that you want to add to that, Dr. Cherry?
Definitely. I think the big thing to note there is if you're going to do an industrial athlete program, you want to offer it to everyone. You don't want to just focus on those that are injured or have been injured. Technically, that may invoke medical treatment beyond first aid. So having a program that's broadly applied to everyone in a voluntary nature, I think, are the big high points there.
Mm-hmm. Matthew put in a comment just now that mentioned sprains and strains are also the most frequently faked and passed along to lawyers in construction anyways.
Yes.
Yeah.
And is that an artifact of it just being the most common injury, or is it easier, like sometimes less proof? I know we could probably have multiple webinars or even books written on that type of topic,
Absolutely. Yeah. Well, before we go to the next subject, then I'll ask you guys kind of the same question again, but we'll ask about how frequently or how quickly are injuries reported in your organization? Do you feel like that those were reported within maybe the first hour after that the injury has occurred? Do you feel like that that's within the first maybe 8 to 24 hours? Are you seeing in your organization that it's over 24 hours? What does that look like there in your specific organization? Then we'll compare that with some of the data that we're seeing here as well. Dr. Cherry?
This, I think, has been something that I've learned so much about working at Axiom for the past 7 years. This was really off my radar before then. And so, I think this is very compelling data. So what we have here is, how does delayed reporting impact the outcome of the case with regard to medical treatment? So is it first aid or medical treatment beyond first aid, things like that? And so what's really powerful is, because we have a fair amount of cases every year, we have robust data on this. And so for instance, we do track a metric of time to reporting the injury from injury occurrence. And really the high level focus here is there's a dramatic difference about calling in the injury within 24 hours versus over 24 hours. We do break it down to further granularity within 1 hour, within 8 hours, or within 8 to 24 hours. But for instance, if we look at those injuries reported after 24 hours, the first aid injury rate is 58%. If we look at all of the cases put together in those first three categories, within 1 hour, within 8 hours, and really essentially within 24 hours, the first aid rate rises to 75%. And that's over thousands and thousands of cases year to date. But it's also been a very common benchmark we've seen over the 20 plus years Axiom has been in business. And this is very counterintuitive. You would think injuries that would require medical treatment beyond first aid are severe and they would need to be called in within the hour or within 8 hours. But this is a common occurrence that we see day in and day out. And I think there's several drivers for this. I think many times it's a minor injury that is either musculoskeletal or maybe a laceration that is kind of not recognized or fully addressed immediately, and people are continuing to work, and then it continues to fester. And it can fester physically, but also maybe even psychologically, where the employee doesn't feel taken care of. And those cases have a dramatically lower first aid rate, and it's just very counterintuitive. You would think, again, that these more severe type injuries requiring medical treatment beyond first aid would be called in very early. And so as we think through this, how do we help change this metric? So really what we've thought about is just some practical recommendations to help reduce late reporting, because what this data is really informing us is injuries should be called in within 24 hours, especially, and the earlier the better, really. But you really want to have a system and a process that deals with reporting injuries timely. Sometimes we say there's this focus on either good systems or good people. You would love to have both, but really the system is what's going to be there day in and day out, especially if someone's on vacation that deals with this type of process. But I think more importantly is fostering a culture of safety that shows the company's commitment from a top-down perspective, where there is this commitment for employee safety. And once that's in place, psychological safety is something that's been relatively new to me the last few years, but I think this is a powerful driver, because if employees don't feel comfortable reporting injuries, minor injuries, that's where we're going to start seeing this same counterintuitive outcome of delayed reporting, which looks like a minor injury but turns into becoming a more complicated injury. So fostering that culture of safety, but it's a kind of a bottom up approach where the average employee feels comfortable forward with just a very simple injury. And then just really educate and train employees on the importance of early reporting, because I think in general, everyone wants to do a good job. They don't want to be a burden on the company or on their coworkers. So if they can quickly talk themselves into not reporting the injury. But if you can give them this information that it's much better off to report an injury early, because that's going to give us the best outcome for you, the injured employee, and for the company, with a higher chance of keeping it at first aid. And so, I think this is something that can really be effective in helping a safety program.
Absolutely. There was a lot of good comments that came in. Sean was mentioning that their policy requires the employees to report incidents, which would be not only injuries, but also illness, accidents, near miss, everything. Yeah. And they require that immediately. I love that. Jack had mentioned they encourage their employees to do as soon as possible, same day if possible, no later than the next day. Some were saying, it kind of ranges within 12 to 36 hours. I really love what Pedro said, where he said within the work shift, thankfully, so 1 hour. And that we talk a lot about the critical hour. And I was going to ask you, Dr. Cherry, if you maybe want to mention that again and kind of go through why that's so important, that critical hour that we talk about having having employees report that immediately there, and what the big difference is and what you can see in some of those outcomes.
And really the critical hour, as you know, Holly, being a ER nurse yourself, stems from emergency medicine and military medicine. And they found that if major injuries can be dealt with, catastrophic injuries can be dealt with within the hour, it makes a huge difference in survivability and even disability for that person. And that's extended into kind of triage and management of all workplace injuries. We've really fostered that type of culture where the longer you wait to report an injury is the loss of opportunity for effective case management, medical treatment, even if it's at the first aid level, because things will continue to fester potentially if they're not addressed timely. And so there's really this huge sequela of effects that happen when there's a delay in time. And so in some ways, I think focusing on an hour really helps at least get people on board, even if there's a delay for, we've talked with many of our clients and they say, it's almost impossible to do it within an hour because of remote work, communication, things like that. But I know, especially for our services, we really try to make it as convenient as possible. And then just another part, I think the near miss recommendation is huge. We don't have near miss information, but I know that is something that can really be a powerful piece of information, because if you have a ton of near misses that aren't manifesting fully into an incident, it could be something brewing. And so you can be proactive if you are tracking your near misses. And I know that that behavior is actually being recorded usually in certain health systems and in some corporate drivers as well, because it's all about process improvement. And it's kind of a shame to wait for an injury to occur, especially if there's a trend going, if you could track it through near misses. And that same psychological safety is critical about reporting near misses.
Stephanie, I mentioned that's what. Go ahead.
Oh, sorry, Holly. Go ahead. I was just going to say that the psychological safety piece that Scott spoke of. That's what we see in these companies that not just have the policy, but the practice and the system in place to support the early reporting, because it's that positive benefit. Then when employees see the way a company responds to small injuries, near misses, incidents, that's what garners that kind of trust, because when we onboard new clients, we hear a couple of different flavors of new clients. One client that says, oh, we're only going to give Axiom the hard stuff. And then we have one client that says, guys, even if it's a hangnail, call Axiom. I don't care how big or how small, call them. And the reason is, people sometimes, like Scott said, they might feel a little silly to call the hangnail in, but the more comfortable people get calling the hangnail in, the more comfortable they're going to get calling something a little bit more serious in, or pointing out a hazard within the workplace. And so what we see over time is you might get a little spike in reporting when you first come on, but over time, and most of our clients stick with this for year over year, what they see is a drastic decrease in incidents because of this positive response. And so even though it feels counterintuitive that the more you report, the more injuries you feel like you're having, but it actually becomes something the opposite trend, where the more people report over time, the less incidents they actually have because of this positive cultural shift.
Yeah, I think the danger is if your policy allows for discretion to the injured employee to where they're deciding at what severity levels should they report. And it's kind of unfair to the employee because, again, they in general want to be a team player, and they know if they've gotten injured, it's kind of like a ding on them and a ding on the company and all that. But really the best outcome possible is reporting early. And so, a whole nother topic that we've addressed before is just sometimes your personal medical history can really affect the outcome of an injury. Say it's kind of a moderate laceration that, if you're working in your garage at home, you may not really deal with too much, but in a professional work setting, because the company is responsible for that injury, there is a higher standard of care. And say if you're diabetic or have some other type of immunodeficiencies, or a host of other chronic medical issues, the chances of infection or poor healing can really be significantly higher. And, the actual injured employee or the coworker or the supervisor may not recognize that, or, many times the company is not allowed to know the personal medical history. So there's multiple layers of complexity to these incident management. So again, that's why I feel having your policy leave out as much discretion to the employee and manager as possible, just because of all those confounding factors.
Yeah. Stephanie brought up a really good point, and we hadn't talked about this a lot, but she had said, I also feel like immediate reporting is necessary, especially if you're looking at a scenario of reasonable suspicion that intoxication may have played a part in the injury. And that makes so much sense.
Yeah. Oh yeah, I guess if we put that hat on, right, like if there's discretion left to the employee, then, if there is a concern about impairment, right, like then definitely the people that have just, if a policy allows for discretion, the folks that may be impaired may be, definitely delaying the reporting for that reason. So there's, I guess, a number of reasons really to enforce, full reporting. Plus, another huge benefit is having the mechanism of injury recorded as part of the record as timely as possible, because our memory fades over probably even over a day, right? Things kind of change. So having a record of the injury for that case is really critical for accurate documentation.
Absolutely.
Yeah, I think
and
Matthew pointed out that sprains and strains is one of the areas that people do go seek lawyers and support. So for exactly that reason of the mechanism and exactly what the employee experienced at the moment of injury is so critical later on in dealing with this. And we always assume, give the employee the benefit of the doubt, but it also also goes to show that positive reporting and having this information documented immediately does go a long way to prevent any sort of fraud or misuse of the system.
Yeah, I think what's misleading is workers' comp will have very lenient rules about you can file a claim maybe even a month later. And maybe that is the case, right? And, obviously workers' comp is by the state or by federal regulation, but still the company can have their own rules and hold employees accountable to that. Because again, there's really, as we talk about this more and more, not many great reasons to delay reporting, right? And so, yes, it may be allowable under workers' comp that, an injury is reported, significantly later, but still the company has kind of that right to have a policy that is much more timely.
Mm-hmm. And we talk about too about we've given the stat up before, but about the OSHA recordability piece of that, the component that fits in there, where we say that even a delay of reporting by even 1 day increases that chance of it becoming OSHA recordable by over 60%. Do you still feel like that's the case, Dr. Cherry? Especially in some of the strains that we see.
Yeah, I think with timely reporting, you can see a huge shift of going from 60% probably down to 30% at the first aid rate.
Mm-hmm. Absolutely. All right. Well, the next thing we're going to cover is the psychological distress. And so my question for you guys would be, do you have a program that currently addresses that? Are you looking at any kind of psychological distress factors? So maybe that's a yes, maybe it's a no, maybe it's we're planning for something for 2025, but we'll look at the association that compares to some of the Axiom data here. And Darryl, I'll come to you for this if you want to talk us through.
Yeah, hopefully my internet's holding up okay. Can you hear me okay,
right now? Yeah.
Okay. We, years ago during COVID and the epidemic that will not be named, realized that employees were struggling at work. Our own employees, clients' employees. Our nurses have always supported the total approach to employee health from an injury perspective, but we started asking a little bit more information just to make sure that employees could be routed into the right support processes. So what we do is we gather what's called a K6. This is a measure of psychological distress. And we are often, because the nurse, and Dr. Cherry sees this a lot in total worker health in general, often the interventions we see from a work-related injury standpoint or a work-related test or some sort of work policy around health and wellness often is the only time an employee gets support because of this moment of intervention. Our nurses build a lot of trust with employees. And so when we check in with them and make sure that they're doing okay, then they're often giving us a little bit more information than they might in terms of picking up a phone call and calling an EAP. So I think a lot of you mentioned that you have EAP programs. Those are phenomenal programs for an employee if they are proactively reaching out, but they have to pick up a call, they have to reach out, there has to be this moment. And so often employees, we find, don't make that action and complete that action unless they're in crisis. So the goal of checking in with employees is just to make sure that they are getting any support through the course of an injury prior to being in crisis. So what the nurses are doing, it's mental health first aid. So it's just like physical first aid. And when we ask these questions, we're just checking in to make sure employees are pointed at an EAP program or handed off to a program if it's needed. Out of all the injuries we've had at Axiom this year, we've got quite a few that have had moderate to severe distress indicated on the case. That doesn't mean that they're in crisis, but it means that they are displaying some pretty significant level of distress. And we want to make sure to hand them off into a system like an EAP system. So, or into other programs if they're available at the organization or within their community. We often see that although an injury comes into us, and I think historically we thought of these injuries as physical, something happens to somebody's ankle, something happens to a physical component of their ability to do their job, it often has ripple effects within the individual or within the organization that go beyond the physical. Motor vehicle incidents, a lot of you mentioned having quite a few motor vehicle incidents within your organization. Some are very mild, some are not. We've had clients with very unfortunate scenarios where somebody has been either severely injured or accidentally killed somebody in the course of work. And so this type of scenario causes something beyond the injury to the individual. There is that ripple effect. So this, if we can help people with psychological and mental health first aid, we do. If not, we make sure to get them the support they need. But we're seeing, especially in some of these seasons, an uptick. So we're hitting the holiday season. And so what we see often around certain timeframes is an uptick in some of those more severe or moderate cases. We have had employees contemplating suicide and other situations, and trying to make sure, because they trust that nurse while they're on the phone, that we route them immediately to support. So this has been something Axiom's done since for the beginning for 25 years, that if an employee coming into us or even a safety individual or an HR person is looking for support in a crisis, we're helping get people into those resources. The check-in, the making sure that we're supporting the team, all of these things were what we've always done. We're just calling it out a little bit more and documenting it so that you can see, in addition to how we're handling the mechanism of the injury for the physical components, there are these other pieces that lead to employees staying healthy, staying safe, and being safe at work. So please jump in if you have questions. I know a lot of you said you've got EAP programs. They might not be utilized enough. I think average utilization is somewhere between 1% to 3% for organizations. And if you see some of these numbers, some of your cases might have quite a bit more than 3% of these cases having some form of psychological distress. So of the ones reported here, we had about 47% in the mild, moderate, and severe ranges. And we want to make sure that those employees don't get left alone, and that they have somebody documenting and supporting them through this experience. Dr. Cherry, anything you wanted to add to that?
Yeah, I think I wanted to hammer home, close to half of injuries have reported some level of psychological distress. And then I almost now want to shift away from population health into kind of the outliers or anecdotes. But if we look at severe at 115, that's a small number compared to the total number. But if you actually just think about looking one person in the eye that's under severe psychological distress, that's quite profound. So if they're at work under severe psychological distress, that almost by definition it's hard for them to focus on the quality of their work, the safety of their work. And so, I think since the pandemic, we've recognized that mental health is fairly common. Mental health challenges are fairly common. I think it's still taboo in general, but this type of program helps potentially, identify people who need help and don't really know how to get help. Some people are probably good about reaching out, but I think the majority of people with mental health challenges really become paralyzed, especially when they become at the moderate and severe level. So any way you can help assist, and I think that's the point of EAP. It's just sadly such an underutilized service. Like you said, Dara, maybe average utilization rate is 2 to 3%. But if we look at the population health statistics, we know people, the proportion of Americans suffering just every year is probably at the 10 to 20%, right? So there's an underutilization of a factor of 3 to 5x, right? And so And then just specifically for the utilization of the importance of this webinar is, psychological stress is highly correlated with injuries, right? And so, and if they're doing physically demanding work or safety sensitive work, that's, concerning for everyone. It's for the employee, for the coworkers, for the environment, et cetera. So, this is a taboo topic that I think eventually will become more mainstream in the future.
We did have Eugene that was asking, how do you measure the psychological distress? Do you want to maybe go through the K6, those questions that they reviewed?
Yeah, K6 is a validated screen measure. Oh,
If you're, I can take that, Holly, if Dara is internet. So, whenever you're doing population health, whatever tools you're utilizing, you want it to be a validated tool that's been assessed in studies to show that what it's revealing is accurate and generalizable to other populations. And so essentially, the Kessler 6, it's a 6-question test that looks at your levels of it's called resilience, but really it's looking at nervousness, hopelessness, restless or fidgety, feeling depressed, how hard it is to start working on things, your feeling of worth, and how often are you feeling those in the past month. And I would just encourage people to Google it, and you can see a sample of this. There's a longer form called the K10, but the K6 is really valid enough to be utilized for the service we're providing. But it will open your eyes to more granular or in-depth questioning about how do you think about distress. The questions I think are very straightforward as well, but it's good to see it kind of just as a line listing of the different questions.
Yeah. Mark had mentioned, he had said the challenge is to be able to recognize the ones that are in moderate to severe distress and be able to help them before it gets worse. And that brings up such a good point. And it made me think of some of the cases that we've seen, Dr. Cherry, especially those that they had called in for a sprain strain and attempted suicide actually, before they had actually called us, but nobody at their workplace had any idea of what was going on. And it was just through the nurse talking them through that we were able to pick up on that and be able to recognize that was going on in addition to that injury that had occurred. I think we've had others that have had, substance abuse problems. You've had crisis that have occurred where, you've had to take them out of the workplace. I don't know if there's anything that you want to expand upon there, Dr. Cherry.
Yeah, Dr. Kurte gave probably the most powerful talk at our client summit several months ago, but I've been working with him on and off for years, and I had never heard him give this personal story, but he talked about how a colleague of his who's also a psychologist, committed suicide and was very dumbfounded because they were in touch with each other weekly, and he shared this intimate, vulnerable piece of information where he realized his friend didn't have the ability to reach out. And so I think, especially what we're doing at Axiom is so powerful because we are proactively asking people. And once you're kind of there, if you've had mental health challenges before and you've been paralyzed, you haven't figured out, or you're kind of lost, you don't know who to reach out to, having a nurse that you trust kind of just check in on you from a psychological aspect could be really the difference. And we've had those cases.
Mm-hmm. One of the other things that comes to mind from him that he had always mentioned was one thing that you as managers and supervisors can do specifically for your employees are ask the 4 most powerful words, which are you okay? And, that goes so far. We think it's so simple, but it makes so much of a difference in terms of being able to ask that employee directly and giving them an opportunity to open up and speak about what may be going on with them.
That might be a great quick barometer, a single question you can ask yourself is regarding psychological safety is when you're at the workforce, if you're at the workplace, if your coworker or manager asks you how you're doing, can you honestly say it, right? And I've worked in many different settings, and I would say that's a variable depending on where I've worked before, so maybe the goal is to kind of bring up the level and awareness of psychological safety in the workplace, and that should help physical injuries as well as employees dealing with, psychological distress.
Absolutely.
And I hope you guys can hear me okay, but I think the other piece in saying that when Dr. Curte presents this to organizations as well, so I've seen this happen time and time again, that he'll be talking about these things like feelings with a bunch of field guys who are kind of tough and they don't talk about feelings. And inevitably, he'll be talking about it, asking them all how they feel. And he'll do polls to keep it light and keep people laughing and moving through it. Every time after the presentation, you will see somebody or multiple somebodies come talk to Dr. Curte. And I think that's the power of asking and having these conversations. It's making these slight adjustments and changes over time. And we're starting to see the shift. Like Scott said, there's still some issues around stigma around these conversations. But by asking, by having somebody trusted like a nurse, making sure employees are doing okay, we're starting to see some really positive shifts within organizations towards this psychological safety experience.
Yeah. Well, the last question I have for you guys, and we'll let Dr. Cherry get into this, but what factors do you believe contribute most to employee fatigue in your organization? Would you say that would be long hours? Do you feel like that's shift work? Do you feel like it's, lack of breaks, a high workload? What do you feel like contributes the most to the fatigue that your employees may be experiencing? And then Dr. Cherry, I'll let you talk about the fatigue data that we have here as well.
And I think this is a great example of this topic, and what we're going to discuss is very straightforward. I think anyone could understand higher fatigue leads to more injuries or more severe injuries or poor outcome of the injury. But unless you have data, it's hard to affect change just internally within your department. But even if you're trying to reach up to higher level management, I've seen many times leaders ask for data that can quantify the magnitude of the topic. But, so again, when we think of fatigue, it is really correlated with risk of injury. When we look at low to moderate, when someone admits to low to moderate fatigue, the first aid rate is below the benchmark of 75%. We're seeing around 70% for low to moderate. And then when we go to high risk, high fatigue levels, it drops down to 62%. So you're almost, there's a 20% change there in the first aid rate. And so obviously, busy operations, sometimes there is the chance of low sleep between shifts, but this is something that is very highly correlated, consistently. And so I think having this metric where it's as part of your dashboard that you can show to supervisors and leadership, it helps inform them the risk that comes with that. I think everyone has that in the back of their mind, but it's not quantified. So having these metrics helps quantify that, right? And so, I think a lot of the times, again, it's in the back of your mind, and you're not really, you're not able to tie it to the quantitative aspect of the risk. But some of the recommendations I think are pretty straightforward, regular breaks or frequent breaks to kind of break up the monotony. Obviously adequate staffing, which I know a lot of times is hard at times if there's vacation or just the hiring freeze, things like that. But, and then also shift work, night shift or rotating, there's a way you can design shift schedules that align with natural circadian rhythms. And, that has been shown to make a huge difference in fatigue. Hold on one second. Apologize. The other component is just making the work environment less fatiguing itself. So maintaining comfortable conditions with adequate lighting, temperature, and ergonomic equipment, because all of these things are like a fatigue tax otherwise that we're not thinking about. Usually we think of fatigue as just poor sleep or not enough sleep or not enough rest, but it can be the environment causing a lot of energy expenditure that's not necessarily associated with performance of the work. Obviously, promoting healthy lifestyles is key. The healthier and fitter you are, the more likely you are to be resilient when it comes to fatigue in the workplace, especially. Or additionally, would be flexible work options. And then lastly, employee education. I think the culture of the generations is pretty interesting. Like I don't know if it's my generation or different generations where lack of sleep is kind of like a badge of honor. And you've heard quotes like, "I'll sleep when I die," things like that. So, I think when employees hear things like that, it may change it pushes the culture into a different version of maybe psychological safety. But, I think it's something to at least be aware of. And then if you can educate, again, fatigue is a major risk factor for injuries that would help empower the employees as well as management.
Absolutely. That's so hard, especially I remember, even working night shift and stuff when you would switch and go from a night shift and then work a day shift. And, that's so hard on your body. And you just feel like you're dragging. And you definitely aren't performing at your best. Dara, did you want to talk through data and how they may want to structure that for their individual organization?
Yeah, hopefully you gathered some interesting information from this webinar and the data. So make sure that there's something practical. We're hoping there's something practical that you took away. Fatigue, like Scott says, and distress and injury data, and all of this is meant to be starting the conversation to push more proactive, so that we can make changes within our structure, programs, people, organizations, so that we can prevent issues from occurring. So that's the primary goal with all of this data is the what next? How do we push upstream and start preventing? And then, let us know if you want copies of any of this. I think you can download the deck or get a copy of the deck from us automatically, but please let us know. This is our aggregated data. If you're a client of ours, reach out. We can run you through your company information and start helping point in some directions for real change within the organization.
Absolutely. Jared, the other thing I was going to ask you was if you could go through kind of give a high level of some of the data that you can expect, some of that we collect and that we provide actually to our clients that would be on those reports that go along with that.
Yeah, you got some samples of it here. Some others are, we dig a lot into early reporting and what that means from an outcome perspective. We track things like PPE and all different components of how injuries come into Axiom. You saw some of the information on behavioral health and K6, but also we're looking at things like comorbidities and other data points where, like Dr. Cherry said, the healthier you are as a population, the more resilient potentially you are both physically and mentally. So that's just a major area of focus for us as we kind of delve into the future of data and getting into those predictive analytics.
Absolutely. And if you have individual data that you'd like for us to look at, we're more than happy to take a look at that for you and kind of give you some of our recommendations as well. Well, we appreciate you guys joining us today. Lots of good information. We look forward to hearing back from you. Many of you will also hear from me and get something in the mail. But if you, as I mentioned, we do have the next event that's going to be coming up. And so what we may do is go ahead and just send you out an email. If you weren't able to see the RSVP that's there, we may send you out an email following this event so that you can get registered for that. And we look forward to seeing you in November, where we have not only Dr. Cherry, but also Les Curte. Thank you, guys.